Thank you very much. We have just held our first official county COVID-19 emergency response team meeting. This was a meeting, a high-level meeting which I chair with the County Commissioner, and we have been able to deliberate on a number of issues, look at the current situation where we are, and all precautionary measures that we have taken to avoid COVID-19. So far, we appreciate that we do not have any positive case in Nyeri. We have had a number of tests. We have about 5 people tested who have all turned negative. We have also got about 33 who are on quarantine and are undergoing observation, all scattered all over the county. We are making a follow-up on them on a daily basis, and so far none of them has exhibited any signs. Today we have discussed, among other things, the need to keep Nyeri free from COVID-19, and we would want to urge our people who are outside this county to remain where they are. I think this idea of thinking that you can move from Nairobi, come to Nyeri, or move from Kisumu, come to Nyeri or Mombasa as a way of quarantine, I think that is not the right way to think. Because when you come to this place, when you come to your parents, when you come to your elders, and you have come from a place that is COVID prone, there are chances that you're going to come and contaminate the area and even bring COVID home. So we would want to wish our brothers and sisters, wherever they are, kindly remain where you are. And any that manages to sneak in and we may not know, we would want to request that they very quickly go into a compulsory personal quarantine of 14 days. We have already identified Wambogo Farm as a place and the institution where we shall forcibly quarantine any person who will fail to adhere to the recommendations of our health committee and ourselves. So generally we would want to say, yes, we have discussed and we have agreed that in the event that we may need to increase our quarantine facilities, we are going to use our schools within the sub-counties. So we really do not want to think of a central quarantine place. We want to say, yes, we have Wambogo Farm for those that have issues, but if there need be, in Madera, we will look for schools around Madera, around Karatina. If it is within Nyeri, we have a number of institutions that we can look into, and this is going to be the last resort. We will get down into better arrangements with the County Director of Education to be so sure of which institutions we can use as quarantine facilities if the need be. We have also been able to go through our capacity, Mount Kenya Hospital and the hospitals around and all, and we must tell our people that yes, there is a challenge. We do not have enough isolation beds in terms of the ICU beds. Nyeri County, I think so far we have less than 20 beds because we have just about 6 in our PGH. We have about 3 in outspan. Madari has 2. We really are incapacitated in terms of having an ICU, and we must also say that in the ICU they are already patients. So this is a challenge. We have also looked at our bed capacity, which runs at around 1,277, which is still inadequate. But all in all, we have discussed so far on matters regarding prevention of infection. This one is going to be done by a continued request to our people to only make necessary trips when they have to make them, to move only when they need to move, and beyond everything else to ensure that they sanitize themselves using sanitizers or they use soap and water. We have also in the plans of sending a team to go to Kibos Sugar Factory, who are working with us and are prepared to give us a continued supply of sanitizers weekly. So this is going to be done. We are going to dispatch 2 lorries to go down there, bring the sanitizer, and when it comes, we will be able to distribute it all over. We must say that we are working very closely with national government who have promised every Friday to be delivering 10,000 bottles of sanitizer to be taken to the transport industry and also to the informal sector. This is something we work very closely together, and we appreciate also the presence of the Red Cross and all others that are ready to work with us.
Right, so you had mentioned that your government is getting ready to have screening centers or areas where we can screen people as
yes.
they come into Nyeri town.
Yes, we are still working on that, and we will be stationing our county teams at those entry points. Like I mentioned last time, it will be Kangosho, it will be Nanyuki, it will be Nairutia, it will also be in Kariko in Odhaya and Mukuroine, so that we ensure that the people that are coming are screened. At least we do the basic testing. So any person coming to Nyeri and you find those teams there, please cooperate with them, because we will have the police, we will have our teams there from the Ministry of Health and our Department of Health, and they will be there taking your temperature and doing some observations. It may cause a little inconvenience, but in the long run, it will be for the safety of the people of Nyeri.
Do we have a timeline for that?
Yes, before the end of the week, we will have rolled out that. We have made orders. We have a challenge with the lesser thermometers. We have made orders. KEMSA has not been able to deliver, so we are trying to look for other options, and we think that in the next 2 days they will be delivered, and we will be able to use them.
The fumigation exercise.
Yes, the fumigation exercise, we had planned to start off yesterday. We were not able to do it because it rained. Today, we already can see the weather is well, so we are going to start in Nyeri town and also Karatina. We will be doing that. That will be after 7. That is when everybody else has gone in the house. There will be a team going around. Our firemen will be in Karatina and in Nyeri, fumigating everything, just as a way of trying to prevent infection.
Working on is to review our progress so far, and I'm happy to report that so far we don't have any case reported. The number of people that we had quarantined, around 6 of them were tested, they are negative, but we are monitoring them at home up to the moment. We have others, 33 that we have isolated, still monitoring them. So far, so we don't have any issue. Now on the area of enforcement, we are working on very well. One, to make sure that our matatus, the number that they were given to carry, and the taxis, they are working on it. We have an additional task now to make sure that the boda carries only 2 people, and as they work on that, they have the masks, and therefore that directive is the one that we want to continue now enforcing, because we need to make our people safe. We've checked on our hawking business and congestion in our markets and bus stations, which is moving on very well.